So that's really huge news. And I was wondering if you could explain the basics and what the premise is of water fasting and what it is about.
Yes. Well, if you don't mind me taking a long run up here through a couple million years here, a million years ago on the African savanna, our ancient foraging ancestors spent all day foraging. The main calories they got was not from mammoth meat. It was from roots and tubers that were dug up mostly by the women. But that's what our small mouths and grinding teeth are about. We're starch eaters. Well, you can imagine our traveling band of foragers there, just by the lay of the land and weather vagaries, that there might be 4 or 5 days go by when you don't find anything to eat, and you drank water if you were lucky. But these enforced water fasts for 4, 5, 6 days were probably the rule back then, and these intermittent fasting periods were just the way it was. And when the body is forced to do without calories, then it has to burn its own fat stores that it has already accumulated. And when it enters that state of metabolizing your own fat as opposed to taking in carbohydrates from the outside, remarkable things happen in the body. These molecules called ketones come in to the bloodstream, and they're the breakdown products of the fat that you're burning. And when there's ketones in the blood, they signal all the tissues in the body to enter a different state altogether. It's a state of conservation. The body doesn't want to waste energy, so it turns down inflammation in the body. Inflammatory reactions are wasteful of heat and energy, so inflammation turns down. Cancer growth also is dialed back. That's a waste of energy. And the body rebalances itself as far as hormone levels go and inflammatory processes. And this is just a normal repair cycle that the body takes advantage of. It's not putting energy out digesting food, then it uses that energy to repair itself, to rebalance its immune system, hormones, etc. Well, and that's just hardwired into us. That's what happens when we're in the fasting state. Well, for 8 years, I was on the staff of True North Health Center in Santa Rosa, California, and we would use therapeutic fasting to take advantage of these remarkable responses the body has to drinking water for a number of days. Blood pressures come down, diabetes gets easier to manage, inflammation cools off, sore joints get better. It's a remarkable state. So there's now a whole discipline of therapeutic water fasting, and we take advantage of these responses in the body. Now, that said, it's a stress on the body, and if you're going to be if you're basically healthy and not on medications, anybody can do a 3, 4, 5 day water fast at home. The body you'll do fine. But if it's longer than that, if you are trying to exert a medical effect, lower high blood pressure, cool off inflamed joints, settle autoimmune disease down, then you ought to be in a place where there's medical supervision. At True North, we did professional water fast supervision. We drew blood on these people, checked their kidney function, checked their liver function, and if everything was okay and they weren't on medications that we couldn't stop at least, we had them start on a water-only fast. So sometimes we use vegetable broth as well. And we watch them like a hawk. We check them twice a day. The intern knocks on the door in the clinic. How are you doing? Any nausea, any headache, getting lightheaded? We watch these folks like a hawk. And if they start getting nauseated or lightheaded, we stop the fast. So this is not something to do in a cavalier manner. It needs to be done professionally. If you're doing it more than a 4 or 5 day fast, you should be supervised. And with that caveat, as I mentioned, it can be a very effective therapy to get improvements in these medical conditions. But as I tell the patients and the young interns who would rotate through there, the fast is wonderful, very powerful, etc. But what really matters is what you eat after the fast. Because if they do this wonderful fast, lower their blood pressure and their joints are cooled off, if they go out then and eat their cheeseburgers and pizzas and buffalo wings, boy, within 48 hours, everything comes back. The blood pressure goes back up, the joints get inflamed, the skin erupts. The water-only fast needs to be a jumping-off platform to get into a whole food plant-based diet. Okay, and while they're fasting, we give them cooking classes and food demonstrations and videos. We want them so when they leave, when they walk into their kitchen at home, they know they're going to be eating soups and salads and veggies and a whole food plant-based diet. And by the way, it's not cruel and unusual punishment to go to a cooking class while you're doing a water fast.
I was thinking that exact thing.
Because by day 3, hunger is gone. The ketones suppress hunger. It's God's gift to fasters. You don't spend 21 days hungry. By day 3, not only are most of these folks not hungry, but all the energy that would normally be used to digest their food is freed up because they're not digesting food, and they feel it in their bodies. Patients would stop me in the courtyard at the clinic. Doc, I feel great. I haven't felt this good in 30 years. I haven't eaten in 3 weeks, but I feel wonderful. It's counterintuitive. You think they're all going to be weak and tired and cold and whimpering on the bed. And the truth is they're not hungry. They feel balanced and good. It's a remarkable state. Some of them go through a detox. They go through a few days of nausea and muscle aches, some of them, not many, but some will go through a detox. But once they go through that, they wind up in this lovely state. Some of them say, Doc, I want to start eating again. I feel so good. But if we get them to refeed on boiled zucchini chunks and vegetable soups and very light reintroduction into the world of eating. And with most of them, we're able to maintain the wonderful changes that they experience in a water fast. So therapeutic water fasting is a real thing, and it needs to be done right by people who know what they're doing. But it's not flaky quack therapies. Can people do a water fast at home? Yes. We spend all day, we eat all the time. We do not tolerate hunger. If you're at all hungry, you hit the fridge or you hit the restaurant. We don't tolerate hunger. But 1 day on water, 2 days on water, it often leaves you lighter and cleaner. Yeah, those are the toughest days there. As I mentioned, by day 3 or 4, the hunger's gone. So we have folks, if you're really into it, once a month, do a weekend on water only, or vegetable broth, which you can make or buy at the store. And then in a month or two, make it 3 days. And then after a month or two, 4 days, and just slowly build up 5 days as far as you want to go. But you can learn how to do water fasting safely at home. And there are articles and books on how to do that. And it would probably benefit us all. If all of us did 3-4 days on water once a month, I think we'd all be healthier for it. But again, it's the food in between the fast that really matters.